Hi, I'm Daniel Fontaine, CEO for the BC Care Providers Association. We're trying something new. Normally we have our Care to Chat at the Terminal City Club over about 3 sessions per year. But because of COVID, we thought it was important for us to have a special Care to Chat, a V edition or a virtual edition. And today we're going to have 6 amazing guests over the next hour who are going to be brought in. We're going to have a discussion with them on the impacts that COVID-19 is having on their organization and their community across Canada. We're going to be starting with Karen Bailey. Karen Bailey is the CEO for Menno Place. She's also been appointed to the new Provincial Reference Group, and that reference group is actually right now dealing with issues like the Single Site Directive and also wage leveling, which we know there's a lot of issues around the costs and where those funds from the provincial government are going to go and be invested in long-term care homes across the province. So we're going to explore a little bit more with Karen about that. We also have Lisa Levin. She is the CEO for Advantage Ontario. And Lisa Levin is located in Toronto, but she has membership across the province and mainly nonprofits. We're going to ask her what's happening in Ontario right now. And as you probably have all been aware, the military has been called in to assist in long-term care homes. So we're going to get the latest status update from Lisa as to how things are going in Ontario and how her organization has been impacted by COVID-19. We're also going to talk to Lisa McKenzie, and Lisa McKenzie is a care aide. She's actually working on the front line. Lisa is out there every single day working with seniors, so we want to get that perspective. We know every night at 7 o'clock we're hearing people banging their pots and pans. Well, it's for people like Lisa McKenzie. So we've invited her to the special Care to Chat to talk about the impacts that COVID-19 is having on her. We're also going to talk to Kim Ironmonger. She is the Director of Business Relations and Special Projects for Northcrest Care, and that's located in Delta. I'd like to know a little bit more about what's happening at Northcrest on the ground. What is COVID-19 doing in terms of operations, and what kind of impacts has it had so far? We're also going to be talking to Jennifer Lyle. She is the CEO for Safe Care BC, and they're responsible for the workplace safety for all long-term care and all home health staff across British Columbia. And Jennifer has been very vocal and very outspoken, and her organization over the last little while about that issue of PPE, personal protective equipment. So we're going to hear a little bit about what's happening with Safe Care BC, and I know that they just released interesting survey results, so we'll explore a little bit more with Jennifer on that. And last but not least, we have a couple of special guests. One I will give you a little bit of a teaser on. They're from the Vancouver Canucks. We're going to have someone on from the Vancouver Canucks to talk a little bit about how COVID-19 and seniors care and the Vancouver Canucks have all collided, but in a very positive way. So we're going to have a special guest there. And I'm going to leave my last special guest as an unknown. You have to stay tuned right through to the end of the program, and you'll get to hear a little bit more from him at the end of the show. So we'll be right back with our first guest. I'd like to welcome Karen Bailey to the program. Karen Bailey is the CEO of Menno Place. She also is the past president for the BC Care Providers Association Board and was recently appointed to the Provincial Reference Group, and that's the group that is managing the whole issue in British Columbia related to COVID-19 and the wage leveling and the single site. So we're going to talk a little bit about that. But first of all, welcome to the program, Karen.
Thanks, Daniel. Glad to be here.
So Karen, we're going to start from a local perspective. You're an operator. You've had, I think, a couple decades working in the sector. Have you ever seen anything like this? And what's happening on the front line with you as both an operator and for your staff? Maybe describe to our viewers and our listeners what's going on there in Abbotsford at Menno Place.
Well, Daniel, this is probably, I can describe this as the highest amount of stress in my 44 years of nursing. I've actually been 40 years now taking care of seniors. I have never had days that have changed moment to moment. We're getting hundreds and hundreds of emails from all directions. Many of those emails are conflicting. So you hear on TV with Bonnie Henry one thing, that says we're at single site. It says that we're, cohorting people for 14 days. And then you get emails from your health authority that says the opposite. So it's been a very confusing time. It's been very stressful on families. It's been very stressful on the staff and on the residents. So yeah, it's when we talk about chaos in healthcare, this is the epitome of chaos in healthcare.
So I think if I could paraphrase, I think this has probably been one of the most challenging experiences in your career, for sure. I'm assuming at Menno and beyond that, just given the complexity and the conflicting information that you say you're getting from both provincial directives as well as from regional directives. Is that correct?
Yeah, it's not just the lack of my hairdresser that's turning me gray. It's the day to day.
So, Karen, you also have spoken out a little bit about the issue of the costs related to this pandemic and things like increased costs for masks and hand sanitizer, et cetera. Have you had any commitments at the time of this taping? Have you had any commitments from the health authority, from the province, to cover any of these costs? Because I know there are, I believe it's in the thousands of dollars that you're spending now more per month on basic supplies that only a couple months ago you weren't having to spend. How is that impacting your operation?
Well, unfortunately, up to this point, so this is what the end of the second month, we've had no commitment at all for any cost recovery. Our masks alone are costing us $25,000 a month, which is a horrendous amount. The new protocols, change continually. At one point we're saying use one mask for a whole shift. Now they're saying use 4 masks. We went to donors. We had people, donating to us and through Safe Care BC. But no, we've had absolutely no commitment for any cost recovery or any staffing recovery. We've completely shifted how we're serving meals. So our meals, we have worked very hard to give quality of life in long-term care by being very social and promoting people to be together. And we've had to flip our operations so that residents and people in assisted living are eating alone in their rooms. So we're having to serve them at their rooms, door to door. In fact, one of our apartment people, said nothing like having room service. So, it takes 3 staff members to go and do the screening, to take them their meals. All of that extra cost at this point has not been committed to being paid.
So BC Seniors Advocate Karen has been very vocal, encouraging families to begin putting pressure to get back into the care home. She's advocating, Ms. McKenzie, for, I believe, thousands of people to begin going back into care homes. Do you know of any consultation that's taken place between the Seniors Advocate and care providers in this province to help support that decision-making process from the Seniors Advocate? Because I know it's triggered a lot of emotion and it's given a lot of people some hope that they're going to be back into care homes within days.
Well, it's really interesting, Daniel. No, I'm not aware of any consultation, but we're quite used to her not talking to us in the industry, and then coming down with things like this. So it's a very big a worry. In fact, I've had families who have said the opposite. In our valley, just yesterday, we heard of 2 more care homes with outbreaks. We've heard of another care home in Chilliwack with an outbreak. So the families are still extremely concerned, and they're very supportive. We started Zoom calls with their families. We had over 100 Zoom calls just last week when we started these Zoom calls. They really are happy that we're keeping their people safe. They come to the windows and they wave and they talk on the phone. But their number one priority is safety. So the families have not been difficult about being restricted. They've been distressed about not being able to come in, but they've also been very creative. I think I sent a picture to a friend of mine of a granddaughter who brings a stepladder and sits outside her grandma's suite so she can talk to her face to face.
Nice. That's really nice. Now, Karen, just switching gears a little bit more from the local to the provincial, you were recently appointed by the BC Care Providers Association Board to sit as the representative on something called the Provincial Reference Group. There's been lots of talk from members of the BC Care Providers for the last number of weeks around 2 big issues. One is called the Single Site Directive, which requires staff to only work at one site, which we know has had some very large operational impacts and some human resource impacts. In addition to that, there's something called the wage leveling, where the government is indicating that through the Dr. Henry's office that care providers are all going to be paid the same wage. So can you describe what's been happening at the provincial front and your involvement with that provincial reference group, and maybe explain to everyone, is there any update that people have in terms of how this is all going to work?
Well, I wish I could give you lots of information, Daniel. So, yes, I was appointed. I think, about 3 or 4 weeks ago. To date, we have had one meeting, which was last week. And that one meeting went over the terms of reference. It also talked about the fact that there's been other task groups that have been looking at the wage leveling and the actual scheduling of the single site, other aspects. In fact, we asked for clarity of what are the other groups talking about, and to date, we haven't seen that. So I do have another meeting scheduled tomorrow, and there is an agenda out. So I think at this point, the provincial committee is relying a lot on the committees that they've set up in the health authorities. And so I am aware of a fair bit of work going on in my health authority, which is the Fraser Health Authority, because again, today we have to have paperwork into them, and they completely switched from one week to the next. At one point, they were going to do all the scheduling, and then the following week, they changed it. So we're doing the scheduling and telling them what we're doing. So yeah, it's very problematic. At this point, it's kind of like nailing Jello to a tree.
Now, Karen, just as we're just about to wrap up, but before I let you go, the whole issue of cash flow, I'm hearing as well as being an issue. And you're a nonprofit organization at Menno Place. You're a fairly large one, and but you obviously have a lot of expenses that you have to incur every single month. But I'm hearing from some care operators across the province that because they haven't, like in places like Ontario and Alberta and Quebec, been given any financial commitments, that they're beginning to experience some significant issues with cash flow. Is that something you're hearing, and is that a concern that you're going to raise at the provincial level?
Well, absolutely. We're all experiencing that. Cash flow is a huge issue. You can imagine we've bought all this PPE, which is way above normal. We've put in extra staffing to completely flip our dietary services, to augment our cleaning. We're doing enhanced cleaning all over the place. None of us are receiving any extra money that I'm aware of. We're tripling people's hours with no extra money. But yes, absolutely, that will be on the table, and we will be pushing that agenda quite hard.
So Karen Bailey, CEO of Menno Place and past president of the BC Care Providers Association, I want to welcome you and thank you again for being able to participate in this special a virtual edition of Care to Chat. Thanks so much for coming on, and best of luck with all your efforts, both in Abbotsford as well as at the provincial level.
Thank you, Daniel. We're all in this together, and we sure have to say thank you to all of our staff because they're working so very, very hard.
Thank you, Karen.
You're welcome.
I want to welcome Lisa Levin, the CEO of Advantage Ontario, to our special edition of Care to Chat, our virtual edition. Lisa Levin, thanks so much for coming on the show today.
You're welcome, Daniel.
So Lisa, for our viewers and those listening online through our podcast, could you let everyone know a little bit about what is Advantage Ontario? Who are you and who do you serve?
Sure. So Advantage Ontario is a association in Ontario, and we serve non-for-profit long-term care homes and providers of seniors housing and services. So we have 400 members from across the province who provide those services.
And you're located in Toronto, if I remember correctly, right? Your office is headquartered there?
Oh, yeah, we're just outside of Toronto in an area called Woodbridge. So it's part of the Greater Toronto area, but we're not working from the office anymore.
That's a good segue, because that's what I was going to ask you. Are your staff now scattered around like mine across living from home and doing everything remote? How has COVID-19 impacted Advantage Ontario in terms of your operations first, and then we're going to go a little bit to your membership?
Sure. So we are all working from home, all of our staff. And fortunately, we had that set up just before the pandemic happened because we wanted to make sure if there was a snowstorm or other kind of climate event that we would be able to all work. So fortunately, we're all set up and we have access to all of our technology and everyone has laptops. So that's worked out really well. And we quickly moved over to an online finance system and other things. So for our members, it's seamless. And pretty much it's all hands on deck. People have been redeployed who have done different things in the organization to help out with the COVID-19 support to our members. And so for some people, like in our policy department, it's similar types of tasks that they did before, like advocacy, government relations, and member support. But for others, like our membership department, they are now doing things like developing lists of personal protective equipment and things like that. So everyone has been working together and helping out.
Yeah, it's a lot like BC Care Providers. Everyone's been repurposed. We've all got new jobs. We're all working on everything from doing almost telethons to getting PPE to completely revamping our staff. So it sounds like you guys are going through the same thing there in Ontario as we are. I'm going to just pivot a little bit to some of the national headlines. When we're living here in British Columbia, we're living and breathing COVID, but I can't help but juxtapose what's happening here as compared to places like Ontario and Quebec, where the military's been called in. It looks like it's pretty severe in terms of Ontario, the impact to long-term care homes. What's happening there compared to a place like here in British Columbia? Can you expand and let our viewers know what the situation is like on the ground there?
Sure, Daniel. So overall, according to the Chief Medical Officer of Health in Ontario, we are in the quote unquote best case scenario in the community of what could have been. But in long-term care and seniors care, it has been absolutely devastating. Why it seems worse than BC and other parts of Canada and the world is something that we are going to have to take a look at once we can catch our breath from all of this. But certainly it has been very challenging. So a lot of our homes, 30,000 beds to be specific, are older homes that the government was in the process of encouraging all of our members to redevelop. And in those homes, there's often 4 people in a room. And it's really hard. I mean, talk about congregate care settings, to have 4 people in a room. And if there's COVID, then, and as we now know, it can be invisible, then it can spread from one person to another very easily. So that's been part of the problem, is the older stock. But beyond that, I think that different provinces responded differently in terms of directives from chief medical officers of health and other things like that. And perhaps there's been more access to personal protective equipment. I don't know. So our homes have, done everything they can to protect the residents based on the available information that they had at the time.
Mm-hmm. Now, Lisa, you and I first met when we both sat on the board of the Canadian Association for Long-Term Care. I know that was one of their critical items that they've been advocating for to the federal government, to get funding for the removal and for us to get rid of these 4-bed wards. In fact, to get rid of care homes with multiple beds. So to try to get as much as we can to the single kind of room model. We've known this for a long time. I mean, you and I have been talking about this on the national front and provincially for so many years. Why are we still talking about this in a pandemic, and why are there still 4-bed wards in places like Ontario?
Well, I think that with so many different priorities, government makes choices, and this has not been the top choice for funding. As you said, Daniel, we worked together and we tried to get the attention of the federal government in particular through that work we did. And I think now people are finally listening. It should not have had to come to this. So the provincial government does have a program to redevelop homes in Ontario, but the funding isn't enough. And there's other barriers as well, but one of the big ones is funding. So I think now that this has happened, we are probably going to see more interest from the federal government and perhaps more funding from the provincial government so that we can get these homes redeveloped as soon as possible.
And I understand that you actually have an inventory and a listing in Ontario of all the homes that do need to be essentially torn down and replaced. So it's not like you're not aware of the homes, and it's not like government doesn't know which homes need to be replaced. But do you think that perhaps one of the silver linings of this pandemic, and it has been so devastating for so many families, it's hard to think of a silver lining on a pandemic, but do you think one of the things coming out of this will be that those older homes will get the funding from the federal government and the provincial governments across Canada to finally be replaced?
Well, I certainly hope so. And we're definitely going to be advocating for that, as I'm sure Caltech and all of the members of Caltech will be advocating for that. And we're not going to let up because we've been asking for it. And now we're seeing what's happening. And ideally, you want to design these homes so that they're single people, like single occupancy with individual washrooms, so that if there's other issues that come up, or even just regular influenza outbreaks, can be the impacts could be minimized, because we see, our residents in long-term care are really vulnerable, and when they get the flu or any other illness, and now we see with COVID, it could be deadly. So we have to do everything we can to safeguard them.
So you're obviously, Lisa, talking to your members each and every day like I am. What are some of the couple of the top challenges that they're telling you they're facing day to day to deal with this COVID-19 pandemic?
The top two issues are human resources and personal protective equipment. So what happens is when a home goes into outbreak, then staff have to go off because they're sick or they've been in contact with someone with a case of COVID-19, so they have to isolate. Or there's been childcare issues, and as well in Ontario now you can only work for one employer if you work in long-term care. So half of the staff in long-term care work part-time, and many of them have multiple jobs. And then in addition to that, many staff are frightened and they leave work and will not work, and they're not compensated, at a level necessarily that is adequate for that kind of dangerous work. So as a result, we have homes that have gone down and lost 25 to 50% of their staff on average, but there have been some extreme cases where homes have lost 80% of their staff. So we have started partnerships with the Registered Nurses Association of Ontario, for example, where they have set up a website where it's sort of like speed dating, where the home that needs staff puts their information on, and then student nurses who can be personal support workers, which is what, I'm not sure what you call them in BC, but here they're personal support workers, care aides. And so they match them. And that in the early days was working. But when we started seeing these widespread pandemics, we really needed to have teams go into homes. And so we've worked with a staffing agency and a home care agency to get these kinds of teams to go into homes. And that's helped. But there's been no one solution. So that's why the Army has come in. They are in 5 homes in Ontario. And that's also why hospitals in Ontario are now sending staff, because hospitals are not as deluged as we had thought. And in fact, they have capacity because they have canceled elective surgeries. So hospital staff, including those with infection prevention and control knowledge and expertise, have been coming in and helping the homes. And also home care staff are being redeployed. Plus, the provincial government has set up a website to find people to work in healthcare. So with all of these different measures together, we're hoping that we can get the staffing that's needed in the homes. And for personal protective equipment, I mean, that's not new anywhere. It's a global shortage, and lots of businesses are being retooled. So long-term care in Ontario is now the priority to receive personal protective equipment, but there are still, it's not like it's just flowing. The government is pretty much rationing it because there's only a limited supply. And the chief medical officer of health's directives basically say in long-term care, you wear 2 masks a day, 2 surgical masks a day, unless you're doing certain procedures, or if the mask gets old, you can change it. So these are not normal protocols for PPE, but these are the kinds of things that we've had to put in place.
So Lisa, in the last minute we have left, I just want to ask you one quick question. So the Ontario government has seemed to be very supportive of your sector. I've seen announcements around them covering the costs of pandemic-related expenditures. And at the time of the taping of this program, we still haven't had that commitment yet from the province of BC. How's your relationship with the province of Ontario? Do you think they're doing enough to support your sector?
I think they're doing a great job. Unfortunately, with this kind of thing, nothing could ever be enough. But given the context, they have been in touch. I speak with the government every day. They did flow money very quickly, and more money is coming. Directives and information are coming out all the time. And so we feel very supported. I think that some things could have been done earlier, but at the same time, it's easy to have hindsight after the fact. And if we had known what we know now a month ago, then perhaps things would have been different. But certainly they have worked tirelessly. I have never seen government move so quickly in my entire life. And we've been really impressed with the response.
Lisa Levin, CEO of Advantage Ontario, thank you so much for coming on this special edition of Care to Chat, our online edition of it. Thank you so much, and the best of luck, and hopefully everything will go well in Ontario and you can get things stabilized sooner rather than later.
Thanks so much, and same for BC. Take care, Daniel.
Thanks so much. I now welcome to the special Care to Chat edition, online edition, Lisa McKenzie. Lisa is a healthcare assistant with Sydney All Care on Vancouver Island. Lisa, welcome to the program.
Thanks so much for having me. I appreciate it.
So, Lisa, tell our listeners and our viewers what is a healthcare assistant? What do you primarily do during the day? Who are your clients? Let us know a little bit of insight into that.
Sure. So I work Sydney All Care residents. We primarily have, well, it's all seniors. I would say it's complex care, so it's all levels of care. We have palliative, we have dementia care. Seniors are, 90 plus even. We have a lot of just different levels of care and different ages. And yeah.
So
I'm
how
a
long?
bath aide there.
You're a bath aide. So how long have you been working now at Sydney All Care as a healthcare assistant?
I've been there for 5 years, but I've been doing the job for 17 years.
Oh, wow. Okay. So you've been able to see a lot in the sector over your 17 years. Is there anything that compares to what's happening right now in the pandemic? Is there anything that you could even compare it to in your 17 years on the job?
No, nothing. We've had different outbreaks over the years at other places I've worked with influenza and different gastrointestinal infections, but nothing like this.
So, Lisa, what is your new normal? Let us know, because obviously I'm not a care aide, I'm not a healthcare assistant, and a lot of our viewers and listeners are not, but they'd like to get a little bit of a sense is what's your new normal now that you're living in COVID and you're having to deal with that? How has it changed your day-to-day work operation?
Yeah, lots has changed in terms of like care aides are only allowed to work at one care facility. Our care home is in complete lockdown, so no visitors are coming in. We've upped our housekeeping. When we come in for our shift, we have to check our temperatures and fill out a COVID questionnaire. The residents are being checked twice a day on day and evening shifts. Temperatures are checked and a questionnaire or screening is being done. So much has changed.
So really not much comparable to, say, even 3 months ago. I mean, what you've just described, I'm assuming, is all being done because of COVID, and it's not something that would be normal practice at your site.
No, it's not. Yeah, it's all to do with COVID. At the beginning, I thought, it was really scary and overwhelming, and everybody's watching the news, and it was a lot. But as time everybody is getting adjusted to the new normal now, and our managers are really good at updating us with the latest protocol from Island Health. So we're following up with that. And they've started a training for us, a COVID training. So they talk about everything from proper hand washing to putting on our protective gear, to if there was an outbreak, they answer our questions. Just everything, which is really great. So I think knowledge is power, and the fact that they are doing all this training for us, it's really reassuring for me, especially.
Now, Lisa, we hear across Canada nightly news reports, and even here in British Columbia, I know SafeCare BC has just issued a media release not long ago talking about the shortage of PPE, the shortage of personal protective equipment. How important is it for you to get access to that PPE, and how does that make you feel if you don't have access to adequate PPE?
Yeah, that was definitely a concern. We have it. So at the moment, we have no outbreaks, and I'm not concerned about it, but it's an absolute necessity for sure. Our managers have been great, and they have ordered, and we have what we need. But if we have an outbreak and we're running low, then that would be a definite problem. We need access to it for sure.
So there may not be shortages on your site, but have you heard from any of your colleagues around the island or anywhere else that there have been shortages? And how do those people feel with the shortages of PPE access?
Mm-hmm. I have heard that everywhere, like on the news everywhere, that there has been a global-wide shortage. And not only are they hard to get, but they've upped the price of getting these products that we need. Mm-hmm. So that's a definite concern. But for right now, we're okay.
So Lisa, You need more, yeah. So Lisa, when you started this job, did you ever think that in the course of your career you would be known as a hero? Because that is exactly how everyone is now referring to care aides and to healthcare assistants across the country. And I think it's a recognition that's long overdue for the fantastic work that you do. But every night now at 7 o'clock, I know in my neighborhood, I've been mentioning it to some of the other guests on the show today, that we're hearing this pots and pans are banging at 7 o'clock. What does that mean to you? How does that make you feel when you hear that?
Oh yeah, we've all been talking about it at work, and it makes us all feel really good. And we're such a team as it is, but to know that our community supports us and we're supporting others. We're doing it. My little family is doing it, and we're out there supporting other healthcare workers at hospitals, frontline workers, truck drivers. My husband's a truck driver, so yeah. We want to support everybody. It's great.
So maybe before we wrap up, just a final question for you. Anything you want to say to the families out there that don't have access to their loved ones right now because of the restrictions on visitation? Anything you'd like to tell those families?
Absolutely. I know it's a huge concern for them, and they're missing their loved ones, and we're doing video chats, and it's something, but I know it's not the same as being with your family member. But we're such a team, and we love our seniors. We love your parents, and we're there for them when you can't be. So we're giving them all the love that we can, and support and reassurance, and we're very calm, and we're keeping them calm, and we're there to support them in any way, and we love them very much.
Lisa McKenzie, on behalf of the entire province and the country, I want to thank you for everything you do every single day. I'm glad that you finally are getting that recognition and appreciation. Thank you so much. I know you work really hard there at Sydney All Care. To your entire team, all the best. Stay safe during this COVID-19, and thanks so much for coming on to the special Care to Chat.
Oh, thank you very much. Thanks for having me.
All the best. I'd like to welcome to the special Care to Chat online edition a special guest today, Kim Ironmonger. She is the Director of Business Relations and Special Projects for Northcrest Care, and that's located in Delta. Welcome to the show, Kim.
Thank you for having me.
So we're going to, in the little bit of time we have a lot of topics, a lot of questions for you, but I'm going to kick it off from the top. I'd like to know a little bit more about what's happening at Northcrest on the ground. What is COVID-19 doing in terms of your operations, and what kind of impacts has it had so far?
Well, as you guys know, these are definitely interesting times in long-term care. I would say the first few weeks were definitely stressful for the staff, and emotions were high. Things were changing constantly through constant emails, as you know, through the health authorities, public health, the ministry, a lot of different emails to sort through. So I didn't have to do that, but our amazing executive director, Sue Emmons, and our DOC, Dee Stewart, had a lot on their plate. So sorting through that was definitely a challenge. I would say we are definitely in our new norm now, and things are going really well. I would say this is the new norm, and I would say staff are functioning very well. Our priority is the residents and the safety of our residents and our staff, and I would say we're doing a really good job of that.
So just for our viewers, for those listening through the podcast, you have not had an outbreak of COVID at Northcrest, just to clarify it so far.
We have not.
Yeah, as
so
of the
far
timing.
We are.
So you're living with
correct.
COVID. Yeah, you're living with COVID, but not in the context of it being at your care site. So
That's right.
Let us know, Kim. We've heard a lot about the issue of people not being able to have access to their loved ones during this time, and that was one of the things the BC Care providers actually called for early on, was for the doors to be closed in order to protect people from COVID. How does that impact the staff? How does that impact the seniors? And what are you guys doing at Northcrest to deal with that?
Yeah, that's definitely been a change. Not having the families come in, and the busyness of a building and the quietness. It's changed the bit of the feel. A lot of our families come in and feed, so we had to adjust a lot of that as well. The staff are doing an incredible job. We right away implemented FaceTime, and we have the ability through our recreation staff to offer that 7 days a week. And we also have iPads, many of them through our recreation department. So it was great. We allowed, we have families sign up for FaceTime slots. And we've been doing that since the beginning, essentially. So that was an easy thing for us to implement quite quickly to keep our residents connected with their families. So we did have that on our side. So that was a huge blessing to our residents. I would say the staff are managing well with, again, like I said to you before, with this new normal and the challenges that it brings. You just have to, as we say, go with the flow each day. So that's what we've been doing.
No, I've heard some fantastic reports, and I also happen to follow your Instagram feed, and I watch on Facebook, and I've noticed that a lot of care providers have been using Facebook and Instagram as a way of kind of communicating out. And what's been interesting with your Instagram feed, and one of the reasons why I wanted you on this special edition of Care to Chat, is I've noticed you guys are getting a lot of food and wonderful gifts from the community. Tell us a little bit about that.
So initially in the beginning, we reached out to, I believe it was Save On Foods, and they just donated incredible baskets. We were just overwhelmed. And I was working from home at the time, and I got a message from our staff, our admin staff. Instantly, they noticed a change. Laughter was coming back in the halls. We saw smiles. People were relaxed. The staff's attitudes and demeanor had changed. So we knew that this was something that we needed to continue with to keep up the staff morale in our building. And we just saw what it was doing and thought, hey, we're going to take this challenge on. So we called many businesses. I found everyone extremely supportive. They were more than willing to jump on board and just donate. We've had over 13 businesses donate.
Wow.
And overwhelming. Safeway just blew our minds. We've had one of our suppliers donate. Pizza Hut, beautiful Indian shops just donating buffet meals. It's been quite emotional. Actually, it's been amazing. The staff have really felt supported. And that was our key through this, is that they felt supported, that they felt like there was some fun. They could have different break times and just be able to head down after a busy, stressful day to lighten the mood with some enjoyable food. We all know food wins us over. So
everyone loves good food. And I've seen that Instagram. I tell you, I get hungry every time I look at your Instagram feed. It's been absolutely amazing.
It's been amazing.
And for those organizations out there who are watching or listening to us, if you do want to support your local care home, just like Kim mentioned, just give them a call and touch base with them. And there are folks like Kim who will be there on the other end of the phone and can receive that call. And as Kim said, it will make a huge impact to the morale on the front line. So before we run and wrap up, Kim, every night at around 7:00, we hear the banging of the pots. I'm sure in your neighborhood, like mine, even in a suburban neighborhood, it's almost deafening now every night at 7:00. What does that mean for your staff? How does that impact them because they really are in long-term care, they are the frontline care providers that everyone's banging the pots for. How do they feel about that?
I think they're just honestly touched, and the support that they feel through this, it's like nothing we've ever seen before. Being in long-term care, yes, there's the hospitals, and that's why I wanted to reach out to our staff to see that they were getting the support that they needed as well. And our families too have just come alongside of us. Today, we just were, again, blown away. We received baskets and Krispy Kreme today and Tim Hortons coffee. We had a family bring in lunch again today. And so just that, along with the pots and pans, all of this has just been a huge support for the staff. And I do feel like they've been supported and that we are seeing them doing their jobs how we used to see it prior to COVID. So that has been the goal through this. So yeah, it's been amazing. Emotional, like today, it was a bit of an emotional day today. So it's just to see have the support.
I think we've all been there. I think the emotions are actually running quite high, but it's been just a very amazing thing to watch the public response. And so, Kim Ironmonger, I just want to thank you so much for coming on this special edition of Care to Chat. Thanks again for all the work that you and the entire team are doing there at Northcrest Care. It means a lot, and really appreciate you taking the time to be here. I know you're incredibly busy, so thanks so much.
Thank you for having me. And again, I want to thank you guys too, BC Care providers, for all that you guys have done for BC and for seniors, and your staff that have been working endless hours as well. So we want to thank you guys for that as well.
Thank you so much, Kim.
Take care.
Very pleased now to welcome to this special edition of Care to Chat, the online edition, Jennifer Lyle. She is the CEO for Safe Care BC and actually works in my office as well. We share an office in Burnaby. Jennifer, thanks so much for being on the show today.
Thanks for having me.
So Jennifer, I'm just going to start with the first question for you, and that relates to what happened to you and your team at Safe Care BC when the COVID pandemic hit. I know you guys are all now working off-site. Maybe quickly describe to us what's happening to the Safe Care BC team right now.
Yeah, so I think for us, really, it was interesting because prior to the pandemic hitting, a lot of our work had been focused on building that culture of safety with the sector. So we build our work plans, we get them developed, we do a big consultative piece. And then what ended up happening is that as the pandemic started building steam, our role started to shift. So it went from monitoring to starting to put out communication and training. And then finally got to a point where we realized, as important as these other initiatives are, we need to be tools down on this and focus fully on the COVID-19 pandemic and supporting our members through this. So for us, it was a lot of readjusting on the fly. We have a fantastic team and some really strong connections. So we were able to do that. But it definitely took a bit of flexibility and adaptation on our part to get to that point.
So for people who are watching this special edition of Care to Chat, maybe let them know who your members are. So who exactly do you represent within the province of British Columbia?
So we represent about 865 different care home and home care operators across the province. And some of them are very large operators and some of them are quite small. So it's a very big mix, but it is across the province.
So one of the things you have been very vocal about over the last few weeks during this pandemic is the issue of something that I hadn't heard a lot about, or that acronym before, PPE, but I think a lot of Canadians are now, and British Columbians, hearing about PPE. Your organization's been very vocal about some concerns you have about PPE. Maybe let our listeners and our viewers know what those concerns are.
Yeah, so this was something that we were flagging pretty early on in the start of the pandemic. I mean, we started to see supply chain disruptions back in January. And it was back in around mid-February that we started flagging this for the Ministry of Health as being an issue. One of our earliest surveys indicated that about 57% of care providers were starting to see problems ordering in supplies. Fast forward to our survey that we administered on April 11th, what we found was about 69% of respondents were looking at having 3 days or less of personal protective equipment. We have done a follow-up survey since then. So our latest survey was done on April 23rd. And we did see an improvement in the trend. We saw about 42% sitting in that category now of having 3 days or less. But I think we have to be very careful about those results because under normal circumstances, we wouldn't be pointing to 42% of people saying they're looking at a critical shortage and saying that's a good result. I think that's just indicative of how challenging the situation is right now for personal protective equipment.
So why should we be concerned about that and having care workers not have access to PPE? What if they don't? Are they in jeopardy themselves, or are the seniors they're caring for in jeopardy?
Personal protective equipment is absolutely critical to keeping people safe in their job. And the saying goes that our care providers, their safety directly impacts the safety of those that they care for. So in terms of preventing the spread of infection, preventing the spread of COVID-19, personal protective equipment is absolutely critical in that fight.
So you represent both home health, you indicated, as well as long-term care. Are you noticing any trends when you're doing your surveys in terms of the difference of access for PPE for your membership base, or is it the same? Are long-term care homes facing the same impact as home health, or vice versa?
We are seeing differences in terms of access. So in that latest round of survey, when we compare the April 11th to April 23rd results, one of the things that we saw that was a shift is that the home health sector is actually now the greatest group that's facing significant challenges. So, for example, whereas about 43% were now saying a critical shortage, that was around 52% in the home care sector. And the thing to remember too on that is, although we saw a number of positive trends across various categories, we actually saw some of those indicators move in a negative direction, specifically in the home health and home support sector. So that would match what we're hearing anecdotally as well around organizations that are working in home health, really having some significant challenges accessing the provincial supply, whereas with long-term care, we're starting to see a little bit more positive reports on that front.
So Jennifer, I would be remiss if I didn't ask you this question before I let you go, but Operation Protect, we've been hearing a lot of radio ads about that across British Columbia. What is Operation Protect, and how is that operation helping frontline care providers?
So Operation Protect is an initiative that was started by Safe Care BC, supported by BC care providers, as well as a number of other organizations. And essentially what it is it's a public drive for personal protective equipment. So we've had over 600,000 items donated now. And when we talk about earlier how we shifted our response to COVID-19, that was one of the first things that we did was identifying the issue of PPE, starting that drive. And so it's been going on for a number of weeks now, and we'll keep on rolling as long as the donations come in.
I have seen you numerous times on the CBC National. You've been doing a lot of national media on this, so kudos to you and to the entire Safe Care BC team for pulling that off. I know everybody has down tools, as I understand it, and they are working out in the field in Operation Protect, working for your membership. Perhaps the last question for you before you wrap up. Moving forward, any lessons to be learned around this pandemic? Are we too kind of still early days to have picked up on some lessons, or anything that you can see already that as a trend or something that we may never do again moving forward?
I think there's definitely some questions to be asked around the PPE front. I mean, everything from in terms of how do we ensure we have an adequate pandemic supply to address the need in the community? Also, too, we have some questions to ask around whether things would have looked differently if we'd had domestic production of personal protective equipment instead of being reliant on, imports from overseas. So certainly some questions on the PPE side. I think there's also lessons to be learned in terms of how the communication has rolled out and having consistency provincially in terms of how directions are being applied and being interpreted. So lots of opportunity to learn. And I think that, again, the end result of this is really just to ensure we're better off the next time something like this happens.
Jennifer Lyle, thank you so much for coming on to our special edition of Care to Chat. Appreciate all the work that you and your team are doing across British Columbia. I know that the care providers really do appreciate all the work and efforts you guys are doing. So thanks so much for coming on today.
Thank you for having me.
Welcome back to the special edition of Care to Chat, the COVID edition. We have a special guest on this segment of the program, Sarah Lumsden. Sarah is the Manager of Employee and Labor Relations, as well as Legal Counsel for the Vancouver Canucks. And I did say earlier in the show that we would have somebody from the Canucks. Now, you may have thought we were bringing in one of the hockey players, but we've got one step above that. We have Sarah with us today because Sarah is going to talk to us a little bit about what's happened to the Vancouver Canucks and how COVID has impacted the Canucks. So welcome to the program.
Hi, thanks for having me. I'm glad to be here. Sorry that I'm not as exciting as the players.
Trust me, way above the players, that's for sure. Our viewers today are very much going to be interested in what, as much as they would love to be seeing hockey, they're very interested in what you're going to say, because you've been working on a very special project with the BC care providers over the last number of weeks. It's been dubbed Operation Canucks. And I know for me, Sarah, we were chatting earlier and I mentioned to you that it really became real for me, this COVID pandemic, when the Canucks canceled games. And I thought, this has to be real, because if hockey isn't happening in Canada, this is really serious. So perhaps let us know a little bit about how the Vancouver Canucks are coping with COVID-19, and then we'll talk a little bit about Operation Canucks in a minute. So how are you doing? How's everybody at the Canucks dealing with this pandemic right now?
Yeah, I mean, clearly things have changed a lot. There's no hockey right now, so that's been definitely a shift of focus. I remember that day, just like you, I think it was the NBA had just announced that they were pausing the season, and then we were all kind of on standby, watching the TV. It felt a little bit surreal, but we're here now. It's been, I think this is week 7 without hockey, not that anyone's counting. And yeah, we've definitely had to shift our focus. We've been doing a lot more in the community, I think, which has been great for us because we get to feel like we're doing something a bit more positive. We've got a meal program with Salvation Army where we're sending, over 500 bag lunches every day to Salvation Army to help out there. And then I've had the pleasure of working on Operation Connect with BC Care. So that's been exciting for me.
Now, for the viewers who aren't aware of what Operation Canucks is, the BC Care Providers actually reached out to Francesco Aquilina, to the owner of the Vancouver Canucks, and I was able to, through various circuitous routes, make my way up to Francesco, and he was very generous in agreeing to help pair some of the staff that normally work at Rogers Arena who aren't working there right now, because obviously there are no hockey games. And we were able to create this Operation Canucks. Tell our viewers a little bit about what that is and the impact it's had on some of your staff.
Yeah, so we've over 2,000 event staff. So those are staff who work, during the games, during the concerts, and obviously none of those things are going on right now. So we've got over 2,000 people who have a sudden drop off of available work. So clearly we were concerned about, our employees and what was going to happen with this lack of work. And then, when we heard from you, it seemed like a really logical pairing because a lot of the work that we do in the arena, whether it's food service or housekeeping or food prep or cooking, any of those things, they kind of match up with the work that is happening at the facilities that you work with. Mm-hmm. So when this came to our attention, it seemed like it made a lot of sense. We had employees that, had a need. They needed to find work, and you had facilities that had a need. So the pair seemed like a really logical way to go. And it's been awesome for us because we can really feel, again, not only that we're helping the community, but we're also helping our staff during a time of need for them. And they've had really positive experiences from what we've heard from them as well. So I think it's been a win-win-win all around.
No, I know that it garnered a lot of attention. I'm not sure if any other hockey teams across Canada are doing it, but I know when we started Operation Canucks, I started getting phone calls from my colleagues across Canada asking, how did you get the Vancouver Canucks to help out? So it's definitely had a lot of attention. So have you had a chance, you said, or I think I heard you say you had a chance to speak to some of the staff, and what's been their reaction to kind of working in a long-term care setting? Because it's very different, obviously, than working at Rogers Arena. What's been the sense from the staff who've spoken to you?
Yeah, we've had a few that have actually reached back out to us unsolicited just to kind of tell us how great their experience has been. I think this sort of general message that we've been hearing is that this is a really scary time for everybody. Everyone's going through, changes and difficult times. And our staff have really appreciated the opportunity to be kind of in the care homes, helping a population that's in need and feeling like they're giving back, feeling like they're not just sitting at home being concerned about what's going on, waiting for hockey to come back. Yeah. They can actually go out into the community and have a positive change. And that's really, kind of brightens up this time for them and been positive in their lives.
I could only imagine that, right? Like you'd want to be able to give back or contribute or do something. And your staff have been amazing. And the feedback we've been getting from the care providers across the metro area where they have been helping has been tremendous. And I know it was a real boost to our staff when the Canucks, I think it was Henrik Sedin or Daniel Sedin, did a little tweet out and did a big shout out to all the seniors and stuff. So really wonderful partnership between the BC care providers and the Vancouver Canucks. Also, I should note that in support of that, I know Van City and I believe Coast Capital Savings also gave some funding and were said if there was any of your staff that needed some training and that kind of stuff, they made commitments. So a real wonderful bringing together of a lot of corporate folks in sports and care. You never would have thought that kind of partnership or relationship would have happened, but it's been pretty exciting.
Yeah, I mean, and it's interesting now looking back, it seems like it makes so much sense and it's so logical, but you're right. I think at the time it was a bit out of the box and people were, like you say, other teams and other organizations saying, wow, what a great idea. But it's been really smooth and it seems to kind of click. So it's been great.
Sarah Lumsden, thank you so much for joining us on this special edition of Care to Chat, COVID edition. Really appreciate, again, the partnership that you've had with the BC care providers, and on behalf of all the seniors and all the care homes in the Metro Vancouver that you guys have made a difference. We really appreciate everything you've done. So thanks for coming on the show, and thanks for everything you've done in support of seniors in British Columbia.
Thank you.
So in closing, the show, I just want to thank everybody who appeared to be a guest today. This is a very difficult time, challenging time for the entire continuing care sector across British Columbia. I'm so appreciative of everybody who participated in this special Care to Chat. We're doing this all now, being physically distant, and we're testing out to see this technology and see how we can work this for potentially something we can build into the fall. So very excited we're able to do this online. And on a personal note, I just want to say thank you to everybody. By the time you see this program, you'll probably know that after 8 years, I'm stepping down as the CEO for the BC Care Providers. I want to thank all of you. It's been an incredible run. I've really enjoyed working in this sector. I'm so passionate about seniors, and whether or not it was the announcement of the provincial government giving us that extra $1 billion to put into direct care, or whether or not it's around Equip Care funding and our SQUIP funding and the $20 million of new funding, right through to so many of the fantastic committees we did on quality. We introduced some quality frameworks. I can't begin to describe all the incredible initiatives and the support, and they couldn't have happened without you as our members and your support. And we've grown so much over the years, as we really are a family. So I feel, like I said in my message when I released the information that I was going, it was with a heavy heart. And I do feel that very much. But thanks again for everything. And I did say at the beginning of the show, we would have a very special guest right at the end of the show. And I'm now able to reveal to you who that special guest is. And that special guest is Mike Clausen. Mike Clausen was announced as being the acting CEO. He'll be taking over from me on May 25th. I know he's going to have a lot on his plate. I know we've been working very closely together. We've actually known each other for the better part of over a couple of decades. So Mike Clausen, welcome to this special edition of Care to Chat.
Thanks for having me on, Daniel.
So Mike, you're going to be taking over the reins in a few weeks. I know there's going to be a bit of a transition period, but you've been around with the BC Care Providers now for, I believe, 3 or 4 years. So you're very familiar with the issues. Tell our viewers, our listeners, what you think will be some of your immediate challenges and some of the things you'd like to do when you take over as CEO for BC Care Providers.
Absolutely. First of all, it's a huge honor to be representing such an important sector, a growing sector, growing for both employment, but in terms of just the thousands of people that need the services that our members provide. As you mentioned, I've been on for almost 4 years now, and I've allowed me to develop some very strong relationships throughout the sector. I really count on our members to make sure that we are on a good path and supporting them at every turn. And so I often call them and seek their counsel, and as well of our board and our staff, who are very knowledgeable. We've managed to have this fantastic team, this fantastic core team in our policy and programs and administration and operations and public affairs departments for many years now. If you kind of look at what the groundwork that you've laid as the CEO of the organization, we're strong, sustainable, and we have a strategic plan that we're about to undertake on. And it starts here in the year 2020 and beyond. I think back to when we really began working on going very public with our message, the Care Can Be There campaign, back in early 2017. Where we started doing TV commercials and using social media and all the power that comes from that. It's really important that we keep the public engaged, because there are so many voices out there, but ours has to be really strong, because the people that we represent are the people who are actually doing the care. And so I think that we hold that great responsibility of making sure that the public, the media, the politicians and the decision makers in governments, both federally, provincially, and in local government, really understand the needs of seniors and all the people who are providing that care. So that's something that will continue on in the days and months to come. We've got some very important things to do, but I think the most important task that faces us at the here and now is COVID-19, and making sure that our members are supported. We've seen some very positive signs with the curve being flattened, and that's thanks to the precautions that were taken by our providers, and as well as some of the visionary and strong work done by the leadership from the Provincial Health Office and as well the Minister of Health. So I'm confident that we can continue to strongly support our members in the months, weeks, and years ahead. And I think that the vision and the groundwork has been laid there, and with the support of our board, I think that we're going to be able to continue to do some very fantastic things for our members.
Well, Mike, I want to give you all the best wishes. I'll do my best to help you through the transition. I know it's a lot of work to take over a role, and I know that you've got an amazing team. We have an amazing team at BC Care Providers, so I have all the confidence that with you at the helm and with that team, there'll be a lot of the trajectory of and the momentum that we built up over the years will just continue. So keep up with the good work, and I'll will not be physically at the office after May 25th. I will be there in spirit. And on that note, I want to just thank, again, the board of directors, President Debji, everybody who's worked with me over the years to give me the opportunity to be at the helm. It's been truly a big honor, a privilege for me. I've thoroughly enjoyed it, and I'm looking forward to my next adventure in the coming weeks. But on that note, we'll wrap up the show for today. And I also just want to, in closing, say thanks to everyone in the public who's been incredible in terms of supporting our members. You heard that today in the show. It means a lot, whether it's the 7 o'clock pot banging, whether or not it's the delivery of sandwiches to some of the care homes. It's meant so much. It really has brought the morale. And you've seen in British Columbia, we've made a difference. We are in a different situation than, thankfully, than so many other jurisdictions around Canada and around the world. So it's all because of everything you've done, our members and the public. So thanks so much. We're going to wrap up the show by showing you some fantastic images as part of our Tell Them You Care campaign. We ask kids and people around the province to just submit messages to seniors who are essentially locked in the care homes right now. They can't come out due to the fact that we're trying to protect them from COVID-19. But we did use technology to get messages into them through our Tell Them You Care campaign. So in closing for the show, enjoy some of those amazing images. And thanks so much for tuning in. I'm Daniel Fontaine, CEO for the BC Care Providers. Thanks again, Mike Clausen, and best of luck. We want to thank our sponsors for the Care to Chat 2019-2020 season. They include Rexall Health Solutions as our title sponsor. Gold sponsors include Arjo and Point Click Care. And our silver sponsors, Sobeys Pharmacy, Pharmacy at Safeway, and Medical Pharmacies.